This nice person here, whom I've never met, contacted me because they were having pain at this particular spot. And they were hoping I might be able to explain why it hurts so much. Which nowadays is probably one of the more loaded questions you can get, because the thought of a singular cause or location for pain is a preposterous idea that should be reviled by all. And sometimes pain is at best a misdirection, especially when chronic. What we can say, while these skeletons are assembling themselves, is that you're better off moving in as many ways as possible. So maybe, if we were to just identify some unmoving parts, someone can help them move better. So I'll just say what I think is held short and needs to be capable of lengthening, and what opposite muscle might have the ability to counter it. So to start somewhere, just ask yourself, what's the most obvious thing of all? Maybe you agree with me that it's how forward the neck and head is. You may also notice a bit of a round through the thorax, which is perfectly normal in this area, provided it can also move out of that position. And maybe also there's a bit of an extension in the low lumbars, as exaggerated by a more prominent gluteal area. Now, an easy way to test out whether these areas are truly stuck this way is to have the person attempt to exaggerate and reduce these positions and see if they stay or they go away. We'll first get them to bend forward. I'll just mention that this was captured from a video they sent me, but I don't want to show the whole thing as I don't want to show their face. So in this position, the thoracic curve is maintained as it's supposed to be, whereas the neck should have moved back into some amount of flexion, but hasn't. So it seems to be stuck in that position. Then we bend backwards, and the neck stays pushed forward, though in this case, that's as expected. When it comes to the thorax, if the thoracic spine were capable of moving out of the flexed position, we would see a flattening of the thoracic spine in this region. And there is some, but not much, so it's likely stuck. You'll notice the lumbar extension is also maintained, but if we switch to a cropped version of the video, there is almost no extra extension capacity going on. They're moving basically solely from the hips, driving the body backwards as a single rigid unit, as opposed to moving sequentially through a flexible spine. Meaning, probably, that though the lumbars are technically in an extended position, they're neither extending or flexing, just stuck. Before I get into the mechanics of all this, the posterior view shows us some differences, but these are probably secondary to the fact that there's almost no forward or backward motion. Not that the side bending and rotation we could see here aren't important, but flexion extension here seem more stuck. It's just a starting point. There's always future considerations. So what are the things holding the stuck things? Arbitrarily, we'll start at the top. This anterior or forward neck is at about C5, 6, 7 mainly. The scalene muscles go from neck to rib at about this angle, and so it's these lower ones that are likely pulling the neck forward. Conversely, the erectus spinae of that region generally run on the back in wide stretches of vertebrae and could likely pull it posterior or backwards. To pull down the neck through those scalenes, though, the ribs are likely down or exhaled, and as a whole, they do appear to be this way. The ribs as a whole would be pulled down by the abdominal muscles like the rectus abdominis and the obliques. To straighten this curve, it is again the job of the erector spinae, just in a lower region now. However, as we get into the thorax, it's worth noting that the respiratory diaphragm, the main breathing muscle, should also be essentially propping up the thorax from the inside. To pull down on the abdominal muscles, it would have to be their lower attachment, the front of the pelvis, which also makes sense because as the pelvis drops down in front, the back goes up, pivoting around the hip joint, which pushes the lumbars into an extension. The muscles that counter this would be the glute max and the hamstrings. And that's about enough right there, enough to work on as a starting point anyways. Now, based on all these positions noted, we could make an argument that this area of pain is at a point of significant convexity and lengthening, the apex of the thoracic curve. And should this person move in such a way as to over-lengthen a muscle or a ligament in the area at already significant length, it could create strain and pain. It could. Conversely, you could simply say that the body is very adaptive and has the capacity to lengthen and avoid that strain and pain. And this is true, but only if it's capable of doing so without error, if the body were capable of adapting effectively at all times. But even if the first point was true, that the stretched curve was the direct cause of pain, it's still irrelevant, because this state of the body is being held by all the other things we talked about. The curve and the pain is an effect, and so even if it were true, it would make no sense to work on it directly. Hopefully, this helps.